Hello, I'm Isabel, and this is From Mud. Like a lotus flower floating effortlessly on the surface in all its beautiful glory, it is a symbol of resilience. Because that same gorgeous flower grew from the icky, sticky muck and mud just below the surface. Something beautiful grows from something dark and cold and unyielding. It grows from mud. This channel is all about resilience and wellness in the face of life's challenges. Thanks for joining. Hello. Welcome back to From Mud. It's me, Isabel, and today I want to dive in to discuss kidney cancer. March is Kidney Cancer Awareness Month, so I think it's only appropriate that I talk a little bit about that. I want to share a little bit about Justin's early warning signs and how he came to find out that he had kidney cancer, and I'm hoping sharing those early warning signs will speak to anyone out there, and if you are having those early warning signs, that you get checked out quicker than we did. And who knows what would have happened if he would have gotten checked earlier on and caught it at an earlier stage. So that's my hope, is sharing these experiences will help others and prevent getting a stage 4 diagnosis, if not help prevent cancer altogether. And yeah, I did a little bit of digging yesterday and just refreshing my mind about kidney cancer and just cancer in general, because a lot of them are kind of related as far as what risk factors exist. And I wanted to just share some of what I found and went over. So before I dive into that, I just want to ask everyone who's with me at this point to, if you appreciate what I'm doing or like what I'm doing or find it helpful, to like, subscribe, share in whatever way you feel called to do these things on any of the platforms I'm on. I'm primarily on YouTube, Apple Music, Instagram, and I recently finished up, for the most part, my new website. I am FromMud.com, and you can sign up for my monthly newsletter. My newsletter is basically going to be a monthly email, and I'm calling it the Monthly Lotus, and where I just send an email with everything I've put out as far as content for the previous month. I'm working on finishing up my first blog to post on there, so it should be included in the newsletter, and I'm hoping to send that newsletter out this week on Friday. So if you like what I'm doing, if you want to support me, if you could like, share, subscribe, wherever you're listening to this, comment on my videos, share my videos. Right now, they're mostly audio because I just don't have a nice setup. I did put out one video podcast so far. So yeah, thanks for being here. Thanks for listening. If you've been listening to some of my stuff or all of my stuff, I very much appreciate it. And without further ado, let's dive in and talk about kidney cancer. I think I want to just start off by talking about Justin specifically. When we found out his kidney cancer diagnosis, we were shocked. Obviously, most people are going to be shocked. And we were shocked because although he does have a lot of cancer on his mom's side, Justin looked very much like his dad and took after his dad a lot, and he was just very Conley man. So I just assumed he would kind of lean in that direction as far as his genetics. His grandpa is going to be 100 years old this year. His dad, Justin's great grandpa, lived to 103. His dad did die kind of young. I believe he was 64 when he passed, and he had cardiac arrest. That side tends to have more heart issues. Yeah, I guess I just assumed that Justin would take more after that Conley side that tends to live really long and have overall good health. So when we got this diagnosis of cancer for him, I was shocked. Justin always had, if you've heard my initial series that I put out, my premiere series on our cancer journey, I spent a little bit of time in the beginning kind of talking about Justin's panic disorder and just being the type of person who really worries about health, and that would often trigger his panic. So he was always a little more of a pessimistic thinker. He struggled with that, I think, and he would often verbalize worst case scenario type fears, especially when it came to health. So once he really started having the panic attacks, he started to, I feel like he would often think it was very serious things, Panic attack can make you feel like it's a heart attack. And that kind of gave way for him to start jumping to those conclusions that things are much worse than they are, or could be much worse than they are. And once it's in your mind, it's in your body. So it's hard to think that away, or it's hard to just say it's in my head and so it's not real. But, sometimes it's in your head and then you start feeling things in your body. So I think there came a point where he was thinking worst case scenario type stuff whenever health things would come up. So yeah, by the time once he peed blood on the airplane, or right when we were about to get on the airplane, he was like, it's cancer. He said that. So for me, I've heard him say things like that often. I think I've heard him say stuff like, whenever there's one little thing that he feels in his body, it's cancer. So I had heard that before. So for me, of course, I'm like, it's not cancer. You're a healthy 30-something-year-old person. You have long living genes. When we got that diagnosis, we were so shocked. So that's actually a good lead-in to talk about early warning signs of kidney cancer. For Justin, the peeing blood is actually what led us to discover the tumor, the origin tumor, the primary tumor on his kidneys, on his kidney. And by that point, it had already spread. So upon discovery of that tumor, we soon after found out that he was already at stage 4. So peeing blood is sometimes one of the first early signs, or one of the earlier signs for people. In Justin's case, it was not an early sign. It was already stage 4 at that point. So I think the peeing blood thing is usually one of the early signs, but again, it depends on what kind of kidney cancer you have. And it might also be that you pee blood, but it's so light you can almost not tell. When Justin peed blood, it looked like all blood. It didn't look like pee mixed with a little bit of blood. It looked like thick, deep red blood. Dark red blood, almost brownish red blood. So that was his kind of like last sign. To backtrack a little bit before that, so prior to the peeing blood, another sign was we had gotten COVID 1 month before he peed blood, and he took a really long time to recover from that. And of course, a lot of people did when they first got COVID. It was, depending on the strain, maybe more challenging. So I just figured he's kind of just being a baby about it, because even though it hit me, kind of hard, but like for a day or two. And I wasn't ever the type of person who really got sick very much. And Justin wasn't really either. He would get sick more than me, but I thought it was taking a lot longer for him to recover. But looking back, I think his body was already under attack at that point. He probably already was at stage 4. His immune system was hit extra hard because of that. So I think that's a sign too, is like, unfortunately, we could have caught it then, but because we got COVID and we were still kind of close to post-COVID era, it was 2022, we had to cancel that CT scan. Because again, you didn't think there was cancer there. We didn't know what was there. We definitely didn't think cancer was going to pop up once he did get those scans. But again, he was scheduled for early May to get scans not for suspicion of cancer, but for the back pain. I'm working backwards. So he peed blood. That's what led us to find out that he actually had stage 4 cancer. 1 month prior to that, he had a hard time recovering from COVID, harder than I would have expected for him with how healthy I thought he was before that. In January and December, he really noticed a sustained weight loss happening, and he wasn't trying to lose weight. And he noticed that he actually lost weight through the holidays, even though he was eating normally and eating the same. So that's when he started getting really concerned. Probably the month prior, he was like, hey, I'm kind of losing weight. But wasn't as concerned about it. He's like, yeah, I'll take it, because he was slightly overweight. He was about 200 pounds at the end of 2021, and he was 5'9". So he was slightly overweight as far as his typical weight, but he started losing weight. So for him, he was kind of like, oh yeah, I'll take it. But then he realized he was losing weight through the holidays, and he had been mentioning that he was kind of concerned about it, or he was asking like, should I be concerned about it? Because I think he also kind of learned that he does have that tendency to worry about his health in ways that might not always be based in reality. So it was a difficult place to be, where it's like you're feeling things, but you also know sometimes your mind has made you feel things and you need to check in with your people. So when he would be telling me about it as a health educator I was already in the field for a while, and I was like, you've brought this up a couple of times, and if you feel like it's bothering you, you should get checked out. If it's bothering you for more than 2 weeks, you should get checked out. I had a pharmacist mention that one time when I was doing my first professional health coaching job, and I like that approach. I feel like if you have an ongoing issue that's going on for more than 2 weeks, or before that, and it's just bothering you, you should advocate for yourself and get it checked out, and push for your medical team to get you checked out. So that was about 6 months before we found out he had stage 4. So when he started losing weight. And I think weight loss is one of those early signs that really pay attention to. If you are losing weight and you're not trying to lose weight, that's a really big one. And that's when he really first brought that up. So he brought it up to the doctor, and the doctor was basically brushed him off like, well, it's a good thing to lose weight. So the doctor totally brushed him off the whole time. But eventually, I'm not sure exactly what the in-between was, but I think between January and June, January when he really got concerned about the weight loss, and June when he found out about the stage 4 diagnosis, somewhere in there he kept being concerned, and then I'm guessing the back pain came back, or kept bothering him to the point where he was like, hey, I want to get this checked out. So I think that's what happened probably in March, April, or something like that. He was like, hey, the back pain is still going on. I'm losing weight. And then the doctor was like, okay, let's schedule for a CT scan in early May. So January, he's starting to lose weight. The only other things before that would be the back pain. And before that, in the summer, was extreme fatigue. So working backwards again, the weight loss became very concerning for him by January of 2022. He was bringing it up with doctor at that point. In, I would say like October, I remember it being October 2021 or so, he started having that back pain, and it might have been even before that, but by October, I think, is when he started doing physical therapy. So probably the previous months, August, maybe that summertime where he started feeling that fatigue, he might have got the back pain. And we had just moved to Arizona from Palm Springs, California, and he started his new job, and he was in an office chair a lot more. So that's kind of what the doctor chalked it up to, is, oh, you're in a chair a lot more. And I know for me, when I first got an office job after being a server for all of my college years and on my feet, sitting down for a really long time gave me back pain for the first time in my life. So it made sense to me, like, yeah, that could be, we're getting a little older, we're in our 30s. If you sit down for too long, I know that's what happened to me. So it kind of made sense at the time. But yeah, the back pain, I would say like summer to fall, he started having that flank pain, that back pain. It was low back pain. It was flank pain if we really think about it. And if he was here, I could ask him, and he would probably say, like, because he eventually got very good at identifying where the pain was radiating from. And so I think that's when the flank pain started, but it was hard to tell, and it was low back pain too. That was probably the tumor growing. That might have been the beginning of it growing. And the fatigue that he felt in the summer, this type of cancer that he had was a very aggressive and fast-growing cancer. So I don't know if a whole year in advance it would have been growing. I'm not sure. I'm not a, cancer pathologist or expert on kidney cancer and its growth, but if that's possible, that would have been maybe the first warning sign, is that extreme fatigue. I just remember that summer before, he started to become extremely fatigued, and I think his mom might have had valley fever. And I think he started thinking, maybe I have valley fever, because it's that persistent, notable exhaustion. And so he wanted, but he didn't pursue it. I wonder if it kind of led up. And then the back pain was the next thing. But again, the doctor was like, well, this and that. We explained it away. Also, I want to just say that no one in Justin's family had his type of cancer. His mom is also a cancer patient, and no one has or had her types of cancer. And both of her parents had two separate cancers. Her mom had 2 bouts of breast cancer, and her dad had prostate cancer, and then he actually died of lung cancer. Prostate cancer, I believe he was pretty young, and then he died of lung cancer in his, I believe, early 80s. So his mom's side does seem to have something genetic about cancer, and so Justin wasn't wrong to be concerned about cancer being a possibility. And again, there's no way to have thought about the kidney cancer being the thing and looking out for kidney cancer signs specifically, because no one else in his family had kidney cancer specifically. So this was a new one, and no one in his family had cancer. Well, maybe they did have cancer that young. I actually don't know what the grandparents' ages were for their first cancer diagnoses. So maybe they were in their 30s, I'm not sure. But no one had a rare cancer like Justin's that hit them as young as his did. So earliest warning signs for Justin, I'm going to go ahead and just say the extreme fatigue, the pain, the back pain, the low back pain that didn't come with an injury. And it is kind of like a dull ache type of, that's how they describe it online when I look on American Cancer Society or kidney cancer. That's how they describe that early symptom or warning sign of kidney cancer for the back pain one, as kind of a dull ache, persistent, it doesn't go away, and it's not associated with any kind of trauma to the area or injury. So again, it was tricky because he was sitting more and it seemed like a reasonable explanation, but he did try physical therapy and it didn't really help him. So I think that might have been another sign. And also I think his would not necessarily come and go, but it didn't go away fully, I don't think. Because that's what kind of led him to really, that and the weight loss really led him to wanting to get the scans in May. So early warning signs for Justin were the fatigue, the back pain, the weight loss, and then the peeing blood. And that was kind of the order of it. And those are kind of some of the big ones that are listed whenever you go and look at some of this information, like from American Cancer Society or Kidney Cancer Association. Both kind of list a lot of those. And then basically he peed blood in the airplane or on the way back. The kidney pain started to become more intense after the peeing blood incident and was just radiating from that kidney area. We thought it was kidney stones. We landed, got to the hospital. Eventually he gets in for scans. Eventually in the wee hours, they tell him they found a baseball-sized tumor on his kidney. And I read somewhere in my mini deep dive on this that this cancer, Justin's specific type, can grow up to 2 centimeters per month or so. So if we kind of go by that, and a baseball is like 7 or 8 centimeters or something, like a circumference of a baseball, that means when he really started having that weight loss, that's around when the tumor started to really go crazy. So by that point, we knew he had the tumor on his kidney. They wouldn't have seen much else at that point, because they were really thinking it was kidney stones. But very soon after, we got more scan results back, and then we could see that there was just widespread of the cancer throughout the lymph in his abdominal cavity. So it was just a bunch of lymph filled in the back wall of his abdominal cavity. There was some in his liver. I believe there was some in his lungs. There was some on his collarbone, and there was some on his spine. And I want to say the base of his head, like the back of his skull, if I'm not mistaken. So it had spread by that point. So when we found out he first had the tumor on his kidney, we didn't know about how far it had metastasized yet. At that point, we actually were still hopeful that it was going to be something simple to remove. And again, Justin was automatically negative. He was kind of like, this is going to be bad. This is going to be really bad. And I was just like, you don't know that. The urologist came in here and was like, oh, it's probably localized, whatever it is. You're a young guy, so I'm sure it'll be fine. And then we go to the first oncologist we saw with the Banner Health system in Surprise, Arizona. We went to the first oncologist, and that oncologist told us what type of cancer and what kind of tumor it is. And I just remember him saying it's non-clear cell renal cell carcinoma with rhabdoid features. This was a rare one, and a particularly rare and aggressive type of kidney cancer. So it's like you keep wanting to hear one thing and you keep hearing the thing you don't want to hear. That's kind of what I mean when it's like it's the one you don't want. Every time they're going to tell us something about this, it ends up being the option we don't want. It's like, if you want, well, hopefully they're going to tell us that it's very treatable and it's very common. Oh no, not very treatable and not very common. Great. And then this tumor type, is it a more common tumor type, or a slow growing? Nope, it's actually it's very rare and it's very aggressive. So at each turn we felt like we got the opposite of what we were hoping for within the context of each of those moments. So eventually we did get all the information about what the tumor type is, what the cancer is. Eventually we get to that one surgeon within the Banner system who really encouraged us to seek out other opinions, and such as Mayo Clinic, and just kind of let us know, like, this is a very rare, very extensive cancer case at this point. He's like, I've not, seen this type of spread of cancer like this in a young person like you. And it's not something I can operate on, because a lot of kidney cancer cases are significantly helped if you can remove that primary tumor. And a lot of times that means removing the kidney. And we were hoping for that option. But because he had what they would tell us, like, there's seeds everywhere. You have this network of lymph that all hold cancer cells and cancer tumors, little lesions, all throughout your abdominal cavity. This primary tumor is also wrapped around your vena cava, so that makes it extra difficult to remove because it risks that vena cava being compromised. You have it in other places in the body. So even if we did try to take out that primary tumor, which already has so much risk, you have all these other seeds everywhere that now spread throughout your bloodstream and through the body. So it's almost like that risk is not worth it unless we can decrease the amount of spread in the body and decrease the size of that tumor so that we can get it to a point that it is operable. So that was our initial approach, and that's what the medical team at Mayo wanted to do, was immunotherapy first, which is a pretty revolutionary newer treatment for kidney cancer. I believe, if I remember correctly, it was actually a treatment developed for lung cancer, and I believe it is still used for lung cancer, but I think by accident it was found to help kidney cancer. And for like half of the patients that do these immunotherapy infusions, 50%, it's like drastically helps improve survival rates. But because that's usually for clear cell, and Justin again had the less common type, he had non-clear cell, and then he had a particularly aggressive differentiation on his tumor type, the rhabdoid features. All of that made it was all fighting against his ability to respond well to the immunotherapy. But for half of the people, immunotherapy is like revolutionary. We were going to go forward with all the things. They kind of looked at us, and then I was pregnant, and newly pregnant when we were going through this. So to explain to the doctors that we would meet, like, yeah, here's my wife, and also she's pregnant. She's like 6 weeks pregnant, and then we have a 1.5-year-old. It's just a heartbreaking situation, but all the doctors were very like, you're young. What's going for you when you're young is that we can throw more things at it, assuming you're like, otherwise pretty healthy. You can throw more things at it, and we're going to throw everything at this. So we started with the immunotherapy and then did scans again, and it didn't show much stopping it or decreasing it. The cancer was still pretty much growing, and I think there was like maybe one area that it was that it had decreased, but there was still growth. And usually if there's any growth, they kind of take it as like the med's not working, like we need to do more. So after that point, again, we were kind of like hoping that we would be in that 50%. That's like, it just is magical and it works, and wow, like you're going to be okay. So of course, again, we didn't go down that route. They were like, nope, we need to switch things up. And that broke Justin. Every time we would have to switch treatments, especially in the early time, because the way he would explain it to me is like, the hope is that you can use one treatment the full extent that most people do or more, right? So like there's people who do that immunotherapy and they can stay on it for like a year, I think maybe even 2 years, maybe more, I don't know. And you don't need any other treatments. So you get 2 years with the first treatment. And then maybe when that treatment stops working, then go to the next to a targeted therapy. And then you can use the full extent of that treatment. And you can, kind of keep kicking the can down the road and use the treatment as long as you can. And the shorter and shorter amount of time you get on the treatment is the sooner you have to go to the next treatment, which means you're running out of options quicker and you're getting less time on those options. So that's how Justin felt when we were told, nope, you already have to go to the next treatment. So by that point, let's see, we found out in June, we probably got into Mayo around July. Started treatment right away. We went on our cruise in October. So July, August, September is probably when he was doing the immunotherapy. We did the scans before our trip. And at that point, they were like, you need to do the targeted therapy. So the plan was right when we got back from the cruise, he took his first dose of the targeted therapy. So he got 3 months on that first immunotherapy combo. Then he added the Cabo. That was the first targeted therapy he was on. Once he started having all the broken back stuff in the following year, that's probably when the Cabo stopped working, or a little before that. Yeah, so he got 3 months on the immunotherapy. And then I believe he continued the immunotherapy, but they took away one med, started him on the Cabo. And then eventually he stopped the immunotherapy, probably caused the compression fractures because the cancer broke through. Also, we had immediate radiation treatments. So he started the immunotherapy, and they also radiated the spinal ones, the spinal lesions. So that was also part of the very early treatment process for Justin. He had this huge, not huge, but probably close to a 3-inch scar on his spine, kind of like below his neck, just slightly above shoulder blade range of the spine. He had a pretty decent scar from that treatment, from that radiation treatment, and it was actually a surgery to remove it, and then radiation. So it was pretty intense. And radiation, he was always happy to radiate because, like he would always say, anytime I can kill some cancer cells, I'm happy. So he loved the idea of radiating things, but the radiation treatment itself was actually quite difficult on his body. Yeah, so then we started the Cabo. So then we got less than a full year on Cabo. Basically got 6 months on Cabo before we started 8 months before all the back stuff started up again. It seems like June was always kind of a rough time of year for him every time. For his remaining years, June was not good to us. June, July. And so October rolls around and goes into the next treatment phase with Cabo and the one immunotherapy med, and that seemed to work for a good amount of time. And for a good-ish amount of time, but you hope these things will last like closer to the 2-year mark. So then by the time all of that went down the next summer, the Cabo stopped working, and it really messed him up that summer, messed him up a lot. And I feel like he started the new med later at the end of summer. So at that point he broke his back and everything. And then he ended up having to, because that was 2023 and he passed in 2024. That's when we got the new oncologist. And also it felt like they were dropping the ball a little bit on appointments and stuff, like in that spring leading up to the summer when the Cabo seemed to have stopped working. And he had brought up the back pain again. That's another thing. Anytime he would have symptoms flaring, that was always a sign that, for us anyway, it's like symptoms would start to flare again. And then that next month, something bigger would happen in the symptoms and he would basically it'd be determined that the medication stopped working. And they kind of told us about that early on, like, when the med is working, you'll know. And when the med's not working, you'll know, like you're going to feel it. But it was hard to just see that as it was happening. It's easier now because I'm reflecting on it. But the back pain started up again. And the oncology team kind of brushed him off. And I think at that point it would have been great if we would have demanded to do scans right away instead of waiting till the mark that we were gonna do them, like in a month, because then it caused those compression fractures. It caused him to have all of this extra abdominal GI tract issues that led to a bunch of other complications, like severe weight loss because of all the vomiting and diarrhea and the GI distress. And later in the summer, it led to that extreme super tachycardia or whatever they call it, the very high pulse rate. It led to a lot of issues because he had to have that extensive radiation done to get this under control because it had just burst through that medication and kind of went out of control. And then they had to radiate a bunch of stuff, which caused his GI issues to be so severe and so difficult to manage. It caused a lot of extra side managing things we needed to do. That's when we started having the infusion, the IVs, IV come to the house for hydration. We did Miralax, a lot of like different over the counters. And this whole time he's been combating the weight loss and he's been doing, we used to do the Boost 500 calories drinks. He would try to get at least 2 of those in per day. And it was very difficult for him to do that. So he would try to get those 2. He started working with a dietitian right away. So that was really helpful to have that part of the team. Eventually he started having to be managed by palliative care. I mean, not too far into it. And they were amazing. That team was amazing at helping. Whenever issues would come up, they would address the symptom and the discomfort that he was experiencing. And that really helped his quality of life the whole time. It could have been a lot worse without them. And then, and then going into 2023, so he breaks his back. He's out all summer. That's when I learned how to be basically single mom / caregiver of my husband. And he recovers October, after the radiation in August. He recovers from that. He starts getting back some mobility because he lost a lot of mobility. He lost a lot of strength in his body and mobility. Getting up and down our stairs, that was just not possible. That's when I first started thinking I don't want a house with stairs anymore because look at this, like Justin can't even get up and down from the stairs without being carried or being in excruciating pain. He had to have like walking sticks and walkers and stuff. So he was in our room a lot, or if he would come down, it would just be a really big ordeal to get him up and down the stairs. So often he would just stay in the room and I'd have to bring him everything until he started getting some strength back. He started the new treatment, which I can't remember right now what those other ones were. I'd have to look it up. The third treatment option. He started that and it started to work really well. And they were actually very positive about, they were like, this treatment actually does tend to work well for your specific type of cancer and tumor type and stuff. So, if things go well, you could get 2 years out of this. So we were holding on to the hope of that. In reality, it lasted from about October 2023 to his passing in July of 2024. So, really it lasted till June, let's say. So, a little over 6 months, like 8 months. And he started improving at that point. Things started he had this new heart issue, but they got that under control I think they had to do like an ablation or something to it. And then that went away. The treatment was working. Things were going down. Things were improving. And He started gaining weight. So again, like then the symptoms start improving. He started gaining weight. His appetite started coming back. He actually was enjoying eating and able to eat things and interested in eating things. He was moving more. He was trying to walk around a little bit. Like he had a goal to walk around our block, which was a short block that he would, just commiserate about how he's like, I can't believe that I can't even just walk our block. He would kind of just talk a little like that about it, like just grieving, He used to just go on jogs and runs and hikes and do all kinds of physical activity. He used to do a dodgeball league in West Hollywood. He played sports his whole life. He was a swimmer. He was a football player. Him and I used to play softball leagues with his work. We would rock climb. We would do any, ocean or water-based activities. We were very active people, and we were active kids as growing up. And when we met each other, we were active. He was a good snowboarder. He was just a very fit, naturally fit person. I mean, he was a little on the heavier side when he got diagnosed, but he was a very strong, agile, fit person, avid hiker, very good hiker, backpacker. We've been on backpacking trips. So for him to be reduced to barely being able to walk a block or two, he was, pretty defeated. It was hard for him to see that as a positive gain to just be able to walk the block. And I put, with my health coach vibe, I'm always like, this is progress, and you always celebrate progress. And we can live in the it should have never been land, but that's not the reality we're living in. The reality is you got this crazy cancer, and it broke your back last summer, and you had to go through all this crazy treatment that was extremely hard and toxic on your body, and you couldn't walk. And here you are walking, 5 to 10 minutes around our block. You weren't able to do that in the summer. So this is good. This is what we need to do, is just keep doing these things. And the doctor would say, like, movement is good if you can. So we were walking. He was getting better. He was gaining weight. He was having more appetite. He was having less pain. He was feeling more positive. And that's when we kind of started trying to squeeze in all the things we could. Go to as many activities, go to as many events, go to our trip to Mexico, which was a 9-hour road trip with the kids one way, and then 9 hours the way back. So, we squeezed in as many adventures as we could while he was improving like that. And, thankfully we did, because we basically, I feel like by January of 2024 is when he was feeling more up for it. And those things were still very hard on him. So, he was really, really pushing himself and trying to just do more when he could do more, but it was still not like how he was before cancer. He didn't have the endurance. He had to nap pretty much every day. And, by the end of the day, he'd be exhausted. And sometimes he would have those bouts of nausea. That was frequent. He would have nausea all the time. Not bouts of fatigue. He just didn't have the energy. It was just really hard. But it was good enough that we could squeeze things in. So we did. And, we had those basically 5.5 good months. By Father's Day, he was struggling. And by mid-July, he passed. So, yeah, that's kind of our cancer journey in a nutshell. And I think I'll switch gears a little bit and talk a little bit about the risk factors that I found when I was really diving into kidney cancer, and I was on the Kidney Cancer Association's website. So, first thing, I'm just going to go over some of these things. So this is from the American Cancer Society, cancer.org, if you want to go look for it yourself. And I actually just Googled kidney cancer risk factors. So when I look into the risk factors for kidney cancer, and this is coming from the American Cancer Society, so if you go cancer.org, these are listed there. So I'm just going to read them off, and then I'll say a little bit about each of them. Okay, smoking, excessive body weight, high blood pressure, family history of kidney cancer, workplace exposure to certain chemicals, being male, race and ethnicity, certain pain meds, advanced kidney disease, genetic and hereditary risk factors. Okay, so under each of these, smoking increases your risk of renal cell carcinoma, the most common type of kidney cancer. Again, Justin had non-clear renal cell carcinoma. So smoking increases the risk of renal cell carcinoma, the most common type of kidney cancer. The increased risk seems to be related to how much you smoke. The risk drops slowly over time if you stop smoking. So for Justin, he wasn't a smoker per se, but during his college years, I remember he had told me he would sometimes take like a drag off of someone's cigarette or, smoke a cigarette here and there when he would be partying and drinking and stuff like that. He went to UC Santa Barbara, big party school. So yeah, when I met him, he would smoke here and there if he was partying, but he wasn't really the type to smoke a lot regularly or anything like that. Side note, I did go and take the Cancer Society's risk assessment. They have like a little question quiz thing that kind of gives you an idea about your risk of cancer. And it asked a question of, have you smoked over 100 cigarettes? So I thought that was an interesting marker, was if you've smoked over 100 cigarettes. I assume that's because that's at the point where it becomes a risk factor, a notable risk factor. So that's just something to think about if you're someone like Justin, where you weren't really like a regular smoker. You didn't, smoke your own packs for most of the time for years and years and years. You were just someone like him where you're partying, you might have a cigarette here and there. Maybe think about that 100 cigarette number as far as like the risk. And at that point, he wasn't smoking anything for years and years. So we didn't consider that really a major risk factor for him, but more than not smoking any at all. Excess body weight, he had a little bit, but not an excessive amount, I wouldn't say, but it is on the list. High blood pressure. It's usually higher in people with high blood pressure. Family history of kidney cancer have a higher chance of developing cancer. This risk is higher for people who have a brother or sister with kidney cancer. Workplace exposure to certain chemicals. Many studies have suggested that being exposed to certain substances at work, such as trichloroethylene or cadmium, increase the risk of RCC. So when I look up where trichloroethylene, TCE, and cadmium pose significant occupational hazards, it says in manufacturing and repair sectors. TCE, a degreaser, is common in metal fabricating, electronics, and dry cleaning. Cadmium exposure occurs primarily in battery production, smelting, alloy manufacturing, and specialized coating industries. Yeah, so none of that applies to Justin in particular, but I was just interested to see what those were associated with. Being male, so renal cell carcinoma is about twice as common in men as it is in women. It says this might be because men are more likely to smoke and historically have been more likely to be exposed to cancer-causing chemicals at work. And I was listening to a presentation from the Kidney Cancer Association, and they was talking about how this is initially true, but after age 55, women tend to, it evens out, that twice as common thing kind of evens out after age 55 for women. So we kind of match the level for men. And the doctor who was talking said that there's suspicion that it might be because there is some hormonal thing at play that is causing the kind of like the playing field to be leveled at that point. So whatever women have as a protective factor prior to that point, post-menopause tends to eliminate those protective factors, possibly due to something hormonal, which I thought was interesting. However, he said that doesn't really, none of that changes treatment approaches. So it probably won't get looked into because right now it's not going to really change treatment approaches, or it seems like it wouldn't. So, and there's limited funding, and these more rare cancers. I mean, kidney cancer is not a rare cancer. It's kind of in the middle. It's not a super common, but it's also not rare. Justin's type of kidney cancer is more of a rare aggressive, but RCC in general is kind of in the middle. Okay, so being male, race and ethnicity, it says pretty much the highest are American Indian, Alaska Native, and then they are slightly higher than African American people, and that's when we compare to white populations in the U.S. Certain pain meds, I thought this was interesting. It says some studies have suggested that long-term use of pain medicines such as acetaminophen and possibly aspirin may be linked to an increased risk of RCC. So and I was reading other studies that were saying this really is more associated with very high level of use, very high strength and dose, and for long periods of time. So it's not like, it's not for the occasional user. This is more of like sustained long-term use for very high doses. Okay, advanced kidney disease. People with advanced kidney disease, especially those needing dialysis, have a higher risk of RCC. It's interesting to me because it's like my mom died of kidney failure and heart failure, and my husband died of kidney cancer. So it's just kidney stuff. I don't know. And my mom was on dialysis before she passed for a few years. Genetic and hereditary risk factors. Some people inherit gene changes from their parents that can increase their risk of RCC. Sometimes this might be the only effect of a gene change, but sometimes it might lead to an inherited syndrome that increases a person's risk of other health issues, including other cancers. It's important that people who have hereditary conditions linked to RCC see their doctors often, especially if they have already been diagnosed with RCC. Some doctors might recommend regular imaging tests such as CT scans to look for new kidney tumors in these people. Most of these conditions listed here result in a much higher risk for getting kidney cancer, although they can account for only a small portion of kidney cancers overall. Von Hippel-Lindau disease, hereditary papillary renal carcinoma, hereditary leiomyomatosis and renal cell cancer, Birt-Hogg-Dubé, BHD syndrome, hereditary paraganglioma, pheochromocytoma syndromes, Cowden syndrome, tuberous sclerosis, BAP1 tumor predisposition syndrome, sickle cell trait and disease. So those are some of the hereditary and genetic risk factors that would be associated with increasing your risk of kidney disease. Justin never had genetic testing done for these things, although he never had genetic testing done to determine if these are genetics at play for him. But it's definitely something on my mind for my kids, because I did read that if you have what do they call it? Like a primary relative, like a parent or a sibling who has kidney disease, your chances of developing it are significantly higher. So it's definitely a concern for me with my kids, and I would like to do the genetic testing to see if any of these are factors. And, maybe if Justin had known, we could have been more aware of. Again, it's hard because we wouldn't have known about the kidney thing to watch out for. So those early signs, it was not on the radar at all. So those are some of the primary risk factors that are listed here on American Cancer Society website. And I also had looked at that article on PubMed in the National Library of Medicine. So pmc.ncbi.nlm.nih.gov, and it was the renal cell carcinoma links and risks, and basically said the same thing there. So to decrease your risks, obviously the genetic things, you can't really change the genetics. You can't change your DNA really, but knowing if you have the increased risk for cancer, and if you have a lot of cancer in your family, you are at increased risk. So it's like for Justin, he didn't really fit most of those other risk factors. He wasn't like overweight his whole life. He was, slightly overweight at that point, but he was overall very healthy. He ate fairly healthy. I'd say he was about average for the way he would eat. And then the tobacco thing, like I mentioned, like it was a little bit here and there for college. So stay away from tobacco, eat healthy and get active. Be safe in the sun. For Justin, I would say he wasn't like an avid sunblock user, unless it was like we were going to be out a long time, and we did live in the desert. And he grew up in the desert as well. So his exposure to sun was there, and increased compared to other people. And then he went to college in Santa Barbara, which is another sunny place. On the same list, protect against HPV, like getting the HPV vaccine, and then knowing your cancer risks. So those are the 5 main things they have listed there. So yeah, for people who are at like increased risk of cancer because you have cancer in your genetics, each of these things that you can address or work on help to decrease the environment that creates cancer cells, right? That creates those mutations that allows cancer to proliferate. So avoiding tobacco and smoke in general, even from vapes and things like that. Just smoke is not supposed to be in our body. So just think about how it's a carcinogen, and carcinogens create more of an environment for those weird mutations to happen and for your cells to mutate in weird ways. And if you have that propensity already to, or that predisposition towards cancer, it just creates that environment where cancer can grow and flourish, right? So if you avoid the tobacco and the smoke in your body, you're taking away one thing that could cause more cancer. If you eat healthy and you're active versus when you're not, again, it creates this more protective environment rather than if you're not eating healthy and you're eating carcinogenic foods. You're eating carcinogenic foods and not eating the protective foods, and you're not active, not getting the benefits of being active. I hope this makes sense the way I'm painting this. All of that creates an environment for more cancer rather than fighting cancer or fighting to prevent cancer. Being safe in the sun, again, it has a carcinogenic effect because the sun denatures your cells, right? It can change your cells on a cellular level, right? So it either you protect your skin and you limit the exposure of that kind of carcinogen, or you don't protect your skin and you allow more of that type of chemical reaction to happen in your body, the interaction between your cells and the sun. So you can either encourage that cancer growth or protect against it. And then the other two, the HPV vaccine, again, it just allows to prevent creating more of an environment for cancer and instead creates an environment that is like uninviting to cancer. So you have these options that are in your control. That is not a guarantee. Again, because, Justin, he wasn't too far off with a lot of these things. He wasn't unhealthy with his diet. He was pretty active, I would say. And the smoking, again, it could have been 0. It was a little bit more. So like all these little things, who knows if these are part of it. He wasn't really in those environmental, occupational exposures, I don't think. But maybe the sun, being exposed to a lot of sun, maybe that could play a role in creating an environment that allowed this type of cancer to proliferate. So when I was doing a lot of health coaching, I would talk a lot about fiber. We would do these presentations for groups and just talk about the benefits of fiber. And I wanted to talk a little bit about that. I might have to do a whole separate thing on fiber just because it deserves its own spot. But I did just want to briefly mention, so other lists that I found were like diets rich in fruits and vegetables are protective against cancer, right? Well, why is that? And it's not just fruits and vegetables, right? It's just fiber foods, high fiber foods, not supplements, but foods from nature. And which foods from nature are going to be the highest in fiber? It's going to be plant-based foods. It's going to be your fruits and vegetables, your nuts, your legumes, your beans, your whole grains. That's where fiber naturally lives. And part of the reason is because the fiber itself, which is, the skeleton basically of these plant foods, it especially has an association with preventing colorectal cancer because it's scraping out the inside of your intestines. I used to work with this dietitian who used to say fiber is like the scrub brush of your intestines. So it's like scraping out all the yucky stuff, and it helps to keep your bowels cleansed and, healthy. And then there's also the types of fiber that you get when you have a high fiber diet. You're going to get your soluble and your insoluble fiber. One of them attracts water, and it's kind of like if you ever eat a chia seed or something like that gelatinous, squishy stuff that encircles the seed. That's pretty much what it is. And it sticks stuff you don't need to it. So cholesterol you don't need, excess glucose, excess calories. We can kind of think of it that way. And sticking to the fiber, and the fiber is bringing it out of the body as waste. The other type of fiber, insoluble, so that was soluble fiber. Insoluble fiber is like roughage. It's going to be things that add bulk to your bowels and help to trigger the process of a bowel movement. And that's getting things out that you don't need. It's scrubbing the insides, right? And it's keeping you regular, which anyone who has ever experienced not being regular with bowel movements knows the torture that is. You want regular bowel movements. When you don't have them, it is torture. If you don't know what I'm talking about, just trust me and eat fiber. But so there's two components. Like the fiber itself does help. The fiber itself also tends to feed good gut bacteria so that you can fight against bad bacteria. Your immune system is affected in a positive way by fiber. Fiber also helps with getting to and maintaining a healthy weight. And fibrous foods, because they are plant-based foods, tend to come with a lot of nutrients that are protective against cancer. So things like, of course, vitamins and minerals, but specifically phytochemicals. And one of the most common phytochemicals you probably know about are antioxidants, are beneficial because they literally combat cells that want to develop into cancer cells and destroy that process. And they create an environment in your body where your immune system can address those changes. So the more fruits, vegetables, nuts, whole grains, beans and legumes that are part of your diet with as minimal processing as possible, the freshest you can possibly get it, and the more of that level of freshness and avoiding processing, the more of those phytochemicals you get in your body, and they literally stop those processes that cause this cancerous environment for the cells, or stop the cancer kind of mutations, or the mutations that would maybe allow for cancer to develop, because it's like a tumor from mutations on mutations on mutations. It stops that process. So if you can emphasize a diet with high fiber, you're naturally going to get eating high fiber foods. Eating a high fiber diet means you're going to get fruits, vegetables, all of these items that come from nature that naturally contain these phytochemicals that create that protective environment for your body. So at the same time, so on one end, you want to have a high fiber diet. You want to have a diet high in plant-based foods in ideally as much as possible their most natural state. On the other hand, you also want to avoid carcinogens in and around your body, right? So we already know that carcinogens cause cancer because they basically damage your cell's DNA. They create genetic mutations that disrupt normal cell growth, repair, and division. So we want to avoid these carcinogens. Well, we definitely know that smoke, any kind of smoke, is known to be carcinogenic. I'm looking at American Cancer Society, so cancer.org, on their page about known and probable human carcinogens. It's a very extensive, long list. Tobacco, any kind of tobacco, smokeless tobacco, secondhand smoke, a lot of different types of things are listed on here. So I'm basically trying to make the point that we want to add these protective things in, like high fiber foods, right? I just put it under the high fiber umbrella, but it's plant-based foods in as little processing state as possible. And we want to eliminate carcinogens. So eliminate smoking. Eliminate damage from the sun by using sunblock, at least 30 SPF, broad spectrum SPF every single day. You put it on whether it's cloudy or rainy or whatever outside, you always put it on. That helps you protect against the sunlight that can cause damage. Another one to eliminate is things in our diet that are carcinogenic. So if you're looking at this same list that I'm looking at, for example, processed meats are a known carcinogen. Okay, so this is going to be from the World Cancer Research Fund. So processed meats, that's going to be sausages, hot dogs, ham, chorizo, bacon, pepperoni, beef jerky, corned beef, pâtés, charcuterie or deli meats such as salami, parma ham, and saucisson. I don't know how to say that without a French accent. Sliced lunch meats, including those made from chicken and turkey. Minced and fresh burgers that are not, minced and fresh burgers are not classified as processed meats. This is because no preservatives have been added. So those are all processed meats that are known carcinogens. It says, how much should I eat? To lower your cancer risk, we recommend eating little, if any, processed meats. If you don't want to completely stop eating processed meats, cut down on how much you eat. Cutting down on how much you eat would be better for your health. As part of a healthy, balanced diet, try to make processed meats something you eat occasionally and not a regular choice. Instead, aim to eat more plant-based foods such as vegetables, fruit, whole grains, pulses like beans, peas, and lentils. So it actually doesn't even want to give you an amount to think about. So as little as possible, it says. I would say if you could get to a once a month thing or less, that might be a good goal. Just to think about it that way, because the Mediterranean eating style pamphlet that I really like, I can't remember where I I think it's called Intermountain Health, that has a Mediterranean eating guide that I like. They have it listed for red meats and sweets 1 to 2 times per month. And that's just for red meats, which are on the probable carcinogen list, not on a known, but on the probable is just red meats in their regular red meat state. So, and that Mediterranean eating style has it as 1 to 2 times per month. So I would say processed meats even less than that. But if red meats, which are just a probable, not a known carcinogen, are listed as recommended for heart health 1 to 2 times per month, I would, if you're eating it pretty regularly, I would try to aim to get to the once a month mark first and then, go from there. Yeah. So those are, and Justin, he ate meat regularly. I was plant-based almost since the time I've known him. He met me in the summer of 2008. And then in January 2009 is when I started my plant-based journey. So he knew me a little bit of time while I ate meat, but the most of the time that he's known me, I was various types of vegetarian or plant-based person. And that whole time he's eaten meat. So, and I grew up eating meat too. So it's not like, most people eat meat. But again, when you have that predisposition to cancer, the more things you can do to avoid exposure to things that might create that environment for cancer, do it. And the more things you can add to your world to combat that or to prevent those environments from occurring as easily, or that fight against those things, like the high fiber diet, like moving your body regularly and at most days, if you can try to get to 5 days a week of at least 30 to 60 minutes of cardio, like a moderate intensity cardio, and doing 2 days of strength training. Those things are protective factors. So as many protective factors as you can get. And there's other lifestyle things too, like it mentioned, the exposure to the sun, wearing sunblock and trying to do that every day. I didn't grow up doing that every day. I lived in Florida, and we would do it if it was like we were going to be out for a long time. I wasn't in the habit of doing it every day, but doing it every day, avoiding carcinogenic things, trying to remove as much meat and especially processed meats, but all meats from your diet as much as possible, or minimizing how much you have. I was reading another article when I was looking into all of this that vegans have the lowest rates of cancer, or maybe it might have been specifically kidney cancer, or it might have been cancer in general. It was saying that basically vegans and vegetarians have significantly lower rates of cancer compared to meat-eating counterparts. And I even looked up, do some of these highly processed plant-based foods have a similar effect? And the answer is no. Even the high processed plant-based foods like the meat alternatives still don't carry the risk factors and the carcinogenic effects that the meat products do. So again, when we think about a diet that is a cancer prevention, it can help for movement, moving your body frequently and in ways that are sustainable for you and feel good for your body, doing some cardio and some strength training throughout your lifetime, sleeping well. There was a question on that cancer screening thing that I did that was like, do you get 7 hours or more, or 7 hour or less than 7 hours of sleep? So I'm guessing that 7 hour mark is a risk factor. If you get more than 7 hours, it's associated with a lower risk of cancer. The other is true for less than that. And that's because it's probably a lot of different things, but we just know that while we're sleeping, there are a lot of things happening where it's not just like a dead state that we used to think a long time ago that nothing's happening, but your body is resetting, hormones are resetting, processes are happening while you're sleeping. So if you give your body enough time for all of those processes, you're at more optimal functioning. And then if you heard my first series, I spent a good amount of time making the point that I think stress has a major component to cancer. There's not a ton of research on this, but it just seems like it would make sense to me that if you have increased stress, it again creates this environment for cancer to grow more easily, weakens your immune system. It's so basically getting stress under control and finding ways to manage your stress despite the stressors. you can't always control the stressors, but you can learn techniques that help you cope with those stressors better, and finding techniques that work for you, and finding different techniques that work for you in different moments, right? You might need more of an in the moment type of stress relief to help you through moments, and you might have more of a maintenance type stress relief that these are activities you do on an ongoing basis that overall contribute to a more relaxed state and help you know the difference between when you're in a relaxed state and when you're in a heightened state of stress, so you can address those things and try and keep yourself into that kind of neutral state most of the time. So those are some of the big ones, risks of kidney cancer and cancer in general. We talked a little bit about all of those risk factors and what we could be doing to prevent cancer. And the good thing is that these things are kind of associated with a lot of different health, chronic illnesses that will help. Eating a high fiber diet is going to help a lot of different things. It helps diabetes, it helps heart disease, it helps cancer, it helps all those things, Alzheimer's, Parkinson's, immune compromising conditions, autoimmune conditions, mental health conditions. All high fiber diets have been shown, and plant-based diets have been shown to help all of those things. So this will help a lot. Again, eliminating the red meats and especially the processed meats, because those are known and probable carcinogens. Eliminating or decreasing your exposure to the sun, using SPF and other tactics like clothing, wide brim hat, covering your skin, being in the shade, things like that. Sleeping well, managing your stress, and not just sleeping 7 hours, but sleeping 7 or more quality hours. Managing stress, not smoking, any kind of smoke. Moving your body in ways that are sustainable. The CDC guideline, last I checked, was 5 days a week of 30 to 60 minutes of cardio, moderate intensity cardio, and 2 days of strength training. And then also there is an additional part of adding flexibility and balance exercises to your routine as well for healthy aging. Those are the main big lifestyle ones. The rest is like genetics and your sex at birth. Like, you can't change these things. You can't change the risks that come because of those things that you had no choice in. But if you are more genetically leaning towards cancer because of your family history, even more reason to embark on this journey of wellness and really start working on all of those things. So all of those things are things to consider when you are trying to determine how to prevent cancer and other illnesses. We also talked about early warning signs. So again, fatigue. And it's like a persistent fatigue that just seems notable. And like you never really wake up feeling energized. And it's ongoing for a long time. Or for longer than 2 weeks. Let's just go with that original pharmacist who told me that. Goes on for more than 2 weeks. It's time to start thinking about counting it as a problem. So the fatigue, the back pain specifically for kidney cancer, the weight loss, that's for all cancers, I believe. I mean, most cancers for sure. And definitely for kidney cancer. And any kind of blood in the urine. All of those things are major early warning signs. You want to get checked out right away. Kidney cancer is only really detected by CT scan. There's not detected, but kidney cancer is not typically screened for preventatively. People usually find out because of a CT scan. So if you have that back pain, you're losing weight, ask for that CT scan. Advocate for yourself. The doctors, sometimes they miss things, even when they have the best intentions. Sometimes people are going by statistics. They're looking at someone like Justin and thinking, you don't really seem like the type of person I have to worry about. And you might get overlooked because of that. So advocate for yourself. If you feel something is not right in your body, don't be afraid to keep pushing for the care and the answers that you need. And yeah, so I'll leave you there. I appreciate all of you. And yeah, Kidney Cancer Awareness Month. Wear your orange. Check out if your city is lighting up somewhere orange. I know here in Portland, it's the OHSU Cancer Building. I think it's like Night, KNIGHT, OHSU Night Cancer center or building. I know they're lighting it up orange here in Portland for kidney cancer awareness. So wear your orange, get your orange ribbons, talk about it, share my podcast. Thank you, and sending out all the good vibes to you all the time. Bye, my friends.